everyone for being with us. We know that there is absolutely no other place that you'd rather be than on a Zoom call Friday, 4 p.m. Here in the greater Portland region, and we're just grateful that you're joining us. My name is Andrew Hone. I'm the president and CEO of the Portland Business Alliance, Greater Portland's Chamber of Commerce. And thank you for joining us for our latest edition of the COVID-19 Recovery Roundtable. Everyone at the Alliance hopes that you're doing well, that you're staying safe and healthy, and practicing appropriate physical distancing and helping all of us flatten the curve. Also, of course, it's always worth acknowledging the amazing healthcare workers who are on the front lines and making sure that the outbreak is contained and taking care of all of us. So we appreciate all the work that you're doing. And as I mentioned before, the Alliance is here to be a resource for all of you. We've set up a page that is COVID-19 focused and updated constantly. There, look at that amazing technology right there on your screen. I don't even have to spell out the website. And of course, follow us on social media for updates. There it is again. This just keeps getting better. Find us on Twitter, Instagram, and elsewhere at that address. Of course, a recording of this presentation and links for resources mentioned will be available right after this presentation is concluded and wrapped up for the evening. And of course, none of these events could be made possible without the support of our members. We appreciate our members. We thank you. Our thoughts are with you, and we're here to help. And we have some incredible sponsors today that I'd really like to acknowledge and, of course, to thank. The first is our sponsor of this COVID-19 Recovery Roundtable series is U.S. Bank, founded in Oregon in 1891. That was before I was born. With a long history of serving businesses of all sizes across the region. U.S. Bank is one of Oregon's most philanthropic companies and provides living wages to 5,000 employees in the Portland metropolitan area and across the state. And in particular, I just want to give a shout out to Stacy Dotson, who's the regional president and a member of the executive committee of the Portland Business Alliance. Stacy, thank you. And to her team, Karen Kerwin, Dave Schwartley, we really appreciate everything you do for us. And our second sponsor of the day is the Building Owners and Managers Association of Oregon, affectionately known as BOMA, founded in 1915, also before I was born. They are the leading voice of the office building industry in Oregon, and combined members of BOMA represent more than 54 million square feet of office space, and that includes commercial, industrial, government, and medical buildings throughout the state of Oregon. BOMA collaborates with the Portland Business Alliance on issues that impact both organizations. Susan Stewart, the executive director of BOMA, we really appreciate you, your board members. She's also a board member of Downtown Portland Clean and Safe, so we thank you, Susan, for your service, and to your entire team, thank you. It's a beneficial partnership, and we appreciate it. So thank you both to U.S. Bank and to BOMA for your support today. This afternoon, we are hearing from the county chairs of the region. I was just informed they affectionately call themselves the Tri-Chairs. So here they are, the Tri-Chairs. Welcome to Multnomah County Chair Deborah Kafoury, Clackamas County Chair Jim Bernard, and Washington County Chair Kathryn Harrington. I wish we could hear the roaring applause for you, so they're out there just so you know, but thank you so much for joining us. They're here to share the latest on statewide prerequisites for reopening our region's economy, and this is an incredible opportunity. And we know that many of you on this call have questions. Share your questions in the Q&A tool at the bottom of your Zoom window. You'll find that if you scroll over the lower portion of the screen. Only questions that are in there will be reviewed through this tool, and we will then try and get to those at the end of the presentation. So make sure to include your full name, your organization, and of course, the location of where your business is when submitting that question. And of course, engage over in the chat function. We really encourage our members to engage over in the chat function with one another. Before we get into the discussion with the Tri-Chairs, we wanted to review where the state guidelines are for Oregon, and we're really happy to welcome a staff member for Governor Brown's office to help walk through the latest framework for reopening the state. I think most of you tuned in to the press conference that happened just the other day. I'm really pleased that we get to welcome Leah Horner, and for those of you who don't know Leah, a lot of us are getting to know her very well. I sit on the governor's governor's economic task force for the state. Leah helps to coordinate that and has really been a great partner for all of us in the business community as we walk through this remarkable time here in the state. So please join me in welcoming Leah. Leah, the floor is yours. Thank you so much for joining us today.
Great, Andrew. Thank you so much. Thank you for having me here today. And I just want to thank everybody who's on this and all the businesses who have kind of stuck with us through all this. I know that it has been hard and painful, and so I just so everybody knows that, you know, we appreciate it very much. So what I'm going to do is walk through some updates that we have had to a previous presentation that probably many of you have seen. So hopefully just the updates are going to be a little bit helpful in framing some of this. And I promise I won't take too long on this. So this first slide kind of outlines the summary of the phases that we have in Oregon right now. And so our current phase, which we're now referring to as the baseline phase, has some updates that were announced last week through our kind of revision of the reopening. And then I think, as everybody has probably been following, phase 1 and a number of counties have been approved to move into phase 1 effective today. And then phase 2, we're still kind of trying to define what phase 2 might look like, but we do know that it will have higher risk activities associated with it. And then phase 3 is really your big sporting events, the highest risk activities, and those that will really require a vaccine. Next slide, please. So I'm going to talk a little bit about the updates to kind of our current state or baseline. If we can move to the next slide, please. And I appreciate the slide mover. So our current state updates that will apply statewide, and some of these might feel just a little bit dated just because everything is moving so quickly, is that on May 1st, we reopened non-emergency procedures for medical and dental clinics that were PPE dependent. And I hear that the supply chain there is a little bit more in place than it was when we opened that on May 1st, but those operations are continuing. May 5th, we announced our outdoor recreation guidelines, where we are opening a little bit more of the recreation where physical distancing can be followed. And then May 15th, which is today, added on standalone retail that was previously closed, but we thought probably could still comply with the OSHA guidelines, as well as statewide guidance that came out a few hours ago, actually, on childcare, summer school, camps, and youth programs. Next slide, please. So again, I'm assuming a lot of people are following this very closely, but there's prerequisites for counties to be entering into phase 1 that are defined on the next slide, please. Here we go. So the prerequisites that we have been talking about is declining COVID-19 prevalence, which is the hospitalizations measured by county declining over a 14-day period, as well as the emergency department visits for COVID-like symptoms. The second one is a minimum testing regimen, which is 30 tests per 10,000 population per week, and accessible testing for underserved communities. And then the third is contact tracing systems in place, which is at least 15 tracers per 100,000 population, and the ability to trace 95% of contacts within 24 hours, also with cultural and linguistic competencies. Next slide, please. Additional prerequisites include isolation and quarantine facilities, available room capacity, and the ability to be responsive for group living outbreaks, which we have seen. And then our finalized statewide sector guidelines, which were finalized today, so we can check that one off. And sufficient healthcare capacity, as well as sufficient PPE supply. I'm gonna ask you to go down. There we go. So these prerequisites for the phased reopening, and this kind of just defines who is responsible for what piece of those. And so you'll see that the testing and the sufficient health care and the sufficient PPE supply is really the responsibility of a collaboration with the health region. And then the county is looking at the declining COVID-19 prevalence, the contact tracing, and the isolation facilities. And so really this is the meat of what each of the counties are looking at in their decisions to apply for reopening in phase 1. And so you'll really, and I'm assuming that that's what the tri-chairs will be focusing on, is really how they're taking a look at that to make sure that they're making the best decisions that they can for the counties that they're representing. We'll go to the next slide, please. This is just a map. I think, and I jokingly say that nobody knows what a health region was, so this map shows the health regions because it's a little bit of a different way for us to be looking at things, but really showing kind of the collaboration that happens county by county, along with the defined health regions to make sure that the public health needs are being addressed. Next slide, please. And we'll go one more slide as we go into talking about phase 1. So we know that a number of counties are entering phase 1 today. And so this chart just shows you a little bit about what the baseline requirements are around each of these, and then what's happening new statewide with the guidelines that came out today, and then what's happening in phase 1. So childcare has been open this entire time with priority for essential workers. The new statewide guidelines expands that to increase cohorts numbers so that we can open up childcare for individuals who are going into, or who work in sectors going into phase 1. And the same will be happening with summer school and camps and other youth programs. I think we talked a little bit about the outdoor recreation since that was announced about 10 days ago already. And then restaurants and bars are also operating mostly on the takeout only model. Phase 1 allows them to go into dine-in operations with additional requirements. And again, those requirements are posted on our website. The same thing happens with personal care. Gyms are also open in phase 1 under additional guidelines. And then the local gatherings still are under phase 1, have a cap of 25. And then I think just the key piece on that is that counties will remain in phase 1 for at least 21 days before they have the ability to apply for phase 2. And as I indicated, we're still trying to define what that looks like. And this next slide just has some examples of the sector-specific guidelines, which again are posted online, and we can make sure that everybody has access to those links. Next slide, please. Okay. So one of the questions we've been getting is, okay, if we go into phase 1, what happens if we are seeing a spike? Will we have to go back into baseline? And the answer to that is probably. And so these are just some of the metrics that we've put out there for consideration of reimposing restrictions in the event that a county has gone to phase 1 and now has to go back to baseline. And I think for business owners, and I think in my own mind, having to toggle from being closed to opening to closing again is probably one of the worst scenarios that folks can imagine. So I think that we're really cognizant of that on our side as well as we're trying to look through these decisions. Next slide. I won't go into phase 2 very much since I've mentioned a couple of times that we're still trying to define what that looks like. But I'm hopeful that that was just kind of a helpful kind of overview of how we got to where we're at right now and what we're looking at as we're moving forward. So with that, I will turn it back to you, Andrew. Thank you.
Thank you so much, Leah, and thank you to our slide operator, Ben, who's always on hand here to make this happen appropriately physically distanced. So I think this is a great setup because I think it really helps to clarify for a lot of people that have been trying to understand what is this approach, and then segueing perfectly into why we have our tri-chairs here with us today So thank you, Leah, and I know you'll stick around to be able to take and field some questions towards the end as we open things up. But I want to now move into our chairs, and I want to start really with you, Chair Kafoury, but these questions are really open for everybody. So, I know you'll know how to pass this off back and forth, and I'll try and move between each of you. So let me begin with you, and the question that I know folks are really interested in today. May 15th was the first day of statewide retail, certain retail reopenings today. So this is a big move for all of us here in the state. So the question now is, when will our metro region be ready to enter into a phased reopening? And using some of these prerequisites that Leah just laid out as a guide for this discussion, you came out yesterday in a press conference and with the announcement of a dashboard, which I think is great, about the prevalence of COVID-19 cases. What's the data showing us today? Do the 3 counties show that we've met this already? And if not, when do the health experts project that we will be ready to potentially apply for a phase 1 opening?
Thank you, Andrew, and thank you to everyone who's participating in this call today. I know that people are really anxious to reopen immediately, but it is my highest priority to ensure that when we do it safely. I also wanted to give a shout out to my two other tri-chairs. We have been working extremely closely together throughout this entire process, and we have made a concerted effort to move as a region because we know that people live in one county, work in a different county, and recreate in even a different county. So it's really imperative that we are working together as a region. That being said, we are still our own unique counties, and so you will hear from us today that we may be on slightly different timelines, but I do believe that the work that we've done to get us to this point is going to be beneficial to us reopening as a region. So we do have, Andrew, thank you for that. We do have a dashboard that's up. It's public facing. There's information about where we are in regards to meeting each of those criteria. We, so far at Multnomah County, have met 3 out of the 7 requirements that the state has said we need to meet in order to get to phase 1. And it's too early for me to give you a date, and I don't want to be held to a date. I think it's more important that we get it right. And because the dashboard is public facing, you will be able to see where we are as we're moving along. The other thing that I would just want to say that we know that the prevalence of COVID-19 cases has gone down overall, but we're also tracking overall prevalence of the disease in communities of color, which we've seen nationally have been disproportionately hit by this pandemic. We're also tracking to make sure that our vulnerable populations, those who are living in our congregate settings, whether it's long-term health facilities, jails, or shelters. So we don't want this opening to benefit some at the expense of others. That's not our values of Multnomah County, and so we're making sure that when we are ready to move to phase 1, that we're doing it as safely as possible for all of our residents.
Thank you for that. I'll
pass it off to Jim.
Thanks.
Sure, absolutely. It would be great to get it.
Well, first, it's been great working with the other chairs. We started talking every day, and now we're 3 days a week. And our folks are coordinating with one another. We're making sure that we, as close as possible, reach this goal together. But that's not necessarily what's going to happen. Clackamas County, I got to say, we've done a great job in this state, flattening the curve. And everyone thinks, well, you don't have a whole lot of deaths and your infection rate is low, let's open. Well, I can guarantee you the day we open, that's going to change. And so at some point, we have to be ready to address that rise in infection rate, unlike we were before. And so we're working to do that. So Clackamas County is reviewing right now, we looked at it on Thursday, a draft reopening plan. On Tuesday, we're going to talk about that plan. I've seen it already, and it's going to be posted tonight. And our goal is to decide on Tuesday whether to put it in on the 22nd. Now, this does not mean we're opening. This means we're putting in the application. And we have to make, 60 to 70% of our people go to Washington County and Multnomah County to go to work. Well, first off, they're not going to have a place to go to work yet. And secondly, we don't want to spread this virus all over again and start, like Deborah said, the worst thing we could do, or actually I think Leah said it, worst thing we could do is have to shut down again. So we're all very cautiously moving forward. So I can't give you an exact date either. I can tell you that we're close, but the application should be in, should the board approve it on the 22nd.
Okay, great. So thank you, Chair Bernard. Chair Harrington, the 22nd for Clackamas is the application date, not the reopen date. What's your thoughts about Washington County?
Well, we have a little bit more work to do. I would first like to start with thank yous to Governor Brown and to all of the members of her team at the state. And if our viewers today have not already looked at the great website, coronavirus.oregon.gov, please do. They have put in tremendous effort, I'm sure, to make all this information as easily accessible and understandable as possible. And then just yesterday, the governor issued a new executive order, 20-25, with regard to a safe and strong Oregon. And that executive order answers so many questions that people have had of us over this last week. I'm really delighted with the support that the state has given us. But yes, it continues to be a very challenging time. You asked about our state of affairs with regard to these 7 prerequisites. Here in Washington County, we have met all but one. And the one remaining prerequisite we need to meet is with regard to our contact tracing, making sure that we have the right numbers of folks to perform the investigations, the contact tracing, the monitoring, the isolation and quarantine support that our community members will need. All of this information, you get these different pieces of the puzzle. So we also need to make sure that we have the right expertise to analyze this information and do the work of knowing if we have outbreaks. The state requirements already require us to have that surge capacity. So ordinarily, we only have 5 contact tracers. Through this process, now remember, Washington County had the first reported case here in Oregon. We've pulled a lot of staff together, up to 40 people now on contact tracing. But those folks are almost at 3 months of being away from their normal work, and the health and vibrancy of our community needs them to get back to work. So this is why just today we had an emergency meeting to approve contracts to bring on upwards of 142 new folks, everything from epidemiologists to nurses, data analysts and data entry. So we're working on that. I'm hopeful that we will get that done soon. And I know also that the state is putting together a new database for us to do this complex work. OHA and the state have done a terrific job taking the database that we had that is far more tailored to the type of infectious diseases that we usually track, like tuberculosis and so forth, and now deal with this new coronavirus. We need new tools and better tools. And I've been told that by our public health experts that the state is expecting to have that database ready in a couple of weeks. So I hope that we'll have those new staff members on board and trained within the next 2 or 3 weeks so we can reopen. But like my colleagues have said here today, our community members live, work, recreate, and learn across our full region and beyond. And we know that if we don't continue to coordinate, that we face tremendous risk and harm to our community members, and we don't want that to happen. We want to make sure that once we transition into phase 1 of the state's reopening strategy, that we will be successful. No digression, please.
I want to add something to this.
Please.
Our application, thankfully, the governor let us know that we didn't have to put all these people on staff, but we can call on them. They need to be trained and ready to go. So our success rate so far is 85%. The goal is 95. The challenge is some people have blocked their phones and we don't have addresses. So the challenge is, how do we get to these folks? I talked to the governor about this morning. And immediately I heard from one of her staff, well, you need more tracers. And I said, the problem is we don't know where they live and they don't answer their phone. So this is a complication we're all going to have to deal with too.
So it really seems, and Chair Harrington, I want to lead up with you on this one, because you mentioned this, and I think it sounds like this is probably the preeminent prerequisite that is missing. That's a mouthful, but around contact tracing. So you said that is the one remaining issue for Washington County, for example. Can you talk to folks about what does it mean to onboard a tracer, and what does that look like for capacity across the region? Because we have the 3 counties here who all need to bulk up on that capacity in order to get to a reopening, or for you all to feel comfortable to be able to meet the prerequisites. So why don't you walk us all through what it means to increase the capacity for contact tracing?
Well, there's no one standard playbook. We each have a different type and level of diversity in our communities. We are committed to make sure that we hire bilingual, bicultural, multicultural folks who reside right here in Washington County. We're going to need to not only hire them, train them on the new tools, make sure they're all set up and good to go. And as Jim mentioned, we have to make sure that they're able to do the level of tracing 95% of the new cases within 24 hours. And we know with the new retail opening starting today, that there's going to be far more interaction of people with one another. That means we're expecting not only the volume of contact tracing to go up, but also the level of complexity. And it's not just for the folks who have tested positive, but we have to make sure that anyone they've come into contact with that is showing symptoms or is also ill, that they and their network of folks get tested as well. So the level of complexity in all of that is increased too, to the level that we have not had to do before, as people have essentially been self-isolating here for the last 6 weeks or so. So it's very complex. Our 3 public health teams, our 3 emergency operations centers are very connected, collaborate daily. So we have no issues there. It's all systems go, go team go. It's just a matter of watching those cases, and we're in different stages of experiencing this virus in our community, but nonetheless, we have new cases every single day. And then we have to make sure that we're able to follow up on all those new cases.
Thank you for that. So to Chair Bernard, then Chair Kafoury, so we heard that was the sole remaining prerequisite that Washington County is trying to meet. Where are you? I heard you say, Chair Bernard, that it's the 19th to the 22nd, you're looking at the application. So do you feel like you've hit all the prerequisites at this point to be able to submit, or are you in a similar condition but expect to have more capacity by that point in time?
Well, we expect to have more capacity at that point in time. We are going to You know, I got to mention that Clackamas County's population was less than 500,000. So we didn't get that federal government check. So we needed some assurance from the governor that, yes, we'll stand behind you. I'm sure our partners, other counties would too. But, you know, I don't expect them to write us checks. But we needed some assurance that if we put these people on, we're going to get compensated for it. So I talked to her about that this morning, and they had an emergency meeting today to talk about how they're going to fund our counties that were under 500,000. And I was not available to watch that, so I'm not sure what's come out of that, but I'm hoping that there is some assurance that we will get the funding to do it. So we have 21 tracers right now, hundreds of people offering to help, but it helps to have a medical background. So, you know, a lot of those people, we're contacting our ambulance folks, AMR. We have a nursing school that is, we're signed in a contract with. So, you know, our application may be delayed. I mean, it'll be put in, but may not be accepted until we reach that certain level. The 95% is key. If we're still at 85, we may have to wait a little longer.
Great. So to Chair Kafoury, where's Multnomah County relative to all these metrics and meeting the numerous prerequisites?
I think we're all in a similar place, where the focus is now on contact tracers. We have quadrupled the number of contact tracers that we had even just 2 months ago, and it's still not enough, as you've heard. I think it can't be overstated. I'm glad that Chair Bernard mentioned that it's not. We are having an outpouring of people who want to help, and I wish I could put them all to work tomorrow. But we really do need people with medical experience in some form and fashion. And we also, as Chair Harrington said, are looking for people who are trusted in their own communities, who speak the language, who are culturally competent. Because there are, for a lot of communities, having someone from the government calling them and asking personal questions, you can imagine how far that will get you. People won't even answer their telephone. So we really need to have someone from community calling and saying, hey, it's okay. And let me be there with you and walk in this path with you while you're answering these questions. So that's something that we take very seriously and that we're working towards as well. And also, as Chair Bernard said, it takes money. We have estimated that in order to fulfill what the criteria that the governor's prerequisites have set out for us, it's going to cost us about $75 million for the next year. And that's to continue all of the physical distancing shelters that we've opened up for people experiencing homelessness. That's dollars for our isolation motels, both for people who are test positive and are sick, but also for people who are in our shelters who are symptomatic, who are elderly, and who have underlying health conditions, to get them out of that congregate living facility. And then, of course, these contact tracers and the supports that go along with it. And frankly, we don't have the money now. We've been told by the state that we're not getting any funding because our region has already gotten funding and the city of Portland has. But the amount of money that has come directly to Multnomah County, about $28 million, $8 million of that will be spent right now, is being spent right now. So that means we have $20 million for the next year. And as I've told you how much it's going to cost, that doesn't quite get us there. We are in conversations with the state and with the city of Portland, because we know that, I think the three of us can fairly say that if our counties aren't open, then the state really isn't open. We are the economic engine of this state. And it's crucial, if we're going to get people back to work and we're going to keep people safe, that we have the ability to do that. We have the dollars that we need.
I'm glad you raised that question around cost, around budget, and Chair Bernard, you mentioned similarly to Chair Kafoury around the unique nature of CARES Act funding when you have a municipality like Portland inside of a county like Multnomah, then you have just a quirk of the CARES Act. But we were really encouraged to see, and you actually had brought this issue up on a previous town hall with us, Chair Kafoury, and I appreciate that you did, because we've seen the city and county, it looks like, working closely together to make sure those resources are available. But going forward, I just want to get a sense, perhaps moving to you, Chair Bernard, and then you, Chair Harrington, do you think that the counties will be able to sustain these budget drivers going forward, and where do you stand, knowing exactly what Chair Kafoury just said, that there's some interesting quirks in the CARES Act, and what your expectations are of the state? So I'll turn it over to all of you really for that. And microphone check.
After talking to the governor, this is my first Zoom meeting. After talking to the governor this morning, I feel fairly confident. The thing is, I guess that I feel a little bit like the state doesn't trust that we will spend the money the right way. Give us the parameters and we'll do it. We're big people. We know how to do this. And we've been working hard as a region, not only us, but the regional disaster preparedness organization, who is also working hard to keep us all coordinated. So I feel pretty confident after talking to her this morning that we'll get there. I was concerned that the grant might be competitive. She tells me it isn't, because I don't want to be out there fighting for dollars that we should have gotten anyway. Personally, I suggested, but she kind of pushed back, that our population, it means we should have got 72 million, but she shut me down on that pretty quickly. That's the federal government. But, we're going to very much depend on the state of Oregon and the federal government, or we're not going to make it. And so more stimulus or more money from the federal government, we have to get it in the state of Oregon, because my guess is we're billions short already, and our health departments, our mental health departments, domestic violence, and all those things have been greatly impacted by this virus. So we need help. We all do.
So I'll contribute that the governor's made it clear that the state does not intend to cover any of the expenses incurred by the 13 cities and the 15 special service districts within our Washington County borders. So that means we have to be really smart about deploying these CARES or Coronavirus Relief Fund dollars. And per the legislation, these dollars have to be spent by the end of this year. So from March 1st through the end of December. Now, make no mistake, there are a lot of qualifying uses of these dollars. There is so much pain and need in our community to address the impact of this COVID-19 disease. And we hope to meet that challenge. Our board has moved forward with a draft set of principles to move forward with the funding. But looking ahead, Multnomah County is a little bit further ahead than we are in having their first estimate for what it's going to take for the next full year of work. We've not had the opportunity to do that yet within our own agency, let alone across all of Washington County. Regionally, we need more resources. We've reached out to our partner jurisdictions to lobby our federal delegation to ensure that there will be additional funds for our state and local efforts, and to make sure that they are flexible and can be used beyond this end of the year deadline that our current coronavirus relief funds have. So working together, we know this is a lot, there's a lot of work here, it's a big lift, and we're committed to continue to collaborate and work together to make sure that our region recovers from this disease as well as from our state. There's too much at risk otherwise.
Thank you for that. So I think obviously we in the business community can do a lot to support the applications of the chairs for resources related to this issue of making sure that we're able to test and trace and all the other requisite health responses. So I think we can get that message loud and clear and certainly support your efforts there, and we're ready to do that. I want to do a quick round the horn with everybody here. Now that we're starting to see reopening guidelines issued and they're going sector by sector and industry by industry, are there areas where any of you anticipate in any one of the counties within your authority, obviously, that you would be adding to these guidelines or making additional recommendations on top of what the state might be promulgating? So if there's any area you see that are specialized to your counties, what might that be so that we can be prepared for that?
I'm sorry, could you just repeat that question again?
So as the sector guidelines are released for, say, retail or for childcare, those are the baselines that are being expected of industries. Do you see the counties adding to those guidelines in any way?
I guess I would say at this point, one of the unique aspects of our region is that not only do we have the densest population, the most hospital systems, the most people experiencing homelessness, vulnerable communities, we also have to take into consideration our transit system. And one of the metrics that we're tracking that is not in the governor's metrics is PPE for transit, because we know that even starting today with the opening up of retail and childcare, that means there's going to be more people riding the bus to work, more people out and about. And so we have to see how all of those levers and all of those stressors play off of each other. I think that's one of the areas that we're focused on right now, that it's not, we're really different than these small counties around the state. We have a lot more considerations and to look at. One other quick thing that I'll say is, I do want to thank the governor's office as well, and the governor herself, that our public health folks worked very closely on the public sector guidance that she outlined, and so that I think she reached out, especially to the Tri-County health officers and Multnomah County's Tri-County health officer, Dr. Jennifer Vines, who's spoken to you before, is the point person for that group, and she was involved in the coordination of these efforts. And in fact, one of the areas that I can say the state moved on was originally they had 2 weeks between each phase, and the Tri-County health officers convinced the governor to go to a 3-week, 21-day between phases, because that really is how long it's going to take to make sure that you're able to track who's getting the disease. The 2-week period is of
Incubation.
Thank you.
Kathryn.
Kathryn, do you have something to add to that?
Yep.
Oh, just, I take a look at my sister county's information as well as the state information, because it's always great to learn new things and to see how we can better communicate and so forth. A lot's coming at a lot of people. You and your audience may know that we here in Washington County have had a disproportionate number of folks from our Latinx community who've been grossly impacted by this virus. I just want to assure you, the very first case that was reported here in Oregon was in Washington County, and that was a multicultural individual. So from day one, we have taken we've used an equity lens through our efforts. We are I think the first EOC in our state to include an equity officer in our EOC. We've worked tremendously with our community partners, our community-based organizations. Is there always room to do more? Absolutely. Because each person and each family is unique. And we need to do everything that we can to help them through this tremendous crisis that they're facing. While some are inconvenienced by the circumstances of this virus, others are feeling tremendous hardship. And it's incumbent upon us in government to make sure that we're helping everyone in need and doing all that we can so that everyone has the opportunity for a good life and to thrive. So thanks to everyone in your audience for being responsible, for washing your hands incessantly and meticulously, for wearing fabric face coverings whenever you leave your house, whenever you're in public, because we're all in this together and we need your help.
Thank you for that. Of course, they're all good Portland Business Alliance members, and that's why they're so perfunctory in responding to the public health needs. So I want to move into audience questions now, but I do want one more question for you, Chair Kafoury, if you don't mind. I heard from Chair Bernard that the 22nd is when they're considering an application. I heard from Chair Harrington 2 to 3 weeks, depending on meeting the last prerequisite. I know we can't put any time projections, but I would love it to hear if you have a crystal ball. What's the vague timeline we might be expecting from Multnomah County?
Well, I've said before that we are still lacking the dollars to get to that phase. So to do my due diligence, got to put a plug in for that. The second thing I would say is we're really viewing today as maybe phase 0.5, because with the opening of retail and of childcare, and just the message that it sends to the community that things are slowly going to open up, we're expecting that we're going to wait. I mean, we're not ready to go anyway, but we also want to see the impacts, what this has. I mean, for example, if someone gets up in the morning, gets on TriMet, goes to drop their kid off at childcare, then they go to work, then they come home, pick up their kid. That's a lot of contact that didn't happen yesterday. So we're going to be watching very carefully our numbers to see how what happens with phase 0.5 affects the county moving forward.
Yeah, I just want to reiterate that we're going to let science and public health guide us through this decision. So while we have some readiness to do, the decision to apply for reopening we're going to wait until we know that the numbers tell us that it's a careful time to proceed.
Let me add one thing to that too. And it's a saying that counties have said a lot. You've seen one county, you've seen one county. We have a large rural population that has had very little virus or sadly the deaths. They also have no hospitals, of course. So that means they have to come to Clackamas County's more dense areas or into Portland, so or Washington County. So it's a little different in all our counties. So we don't have as diverse a population, but we have a lot of farmland. So we're going to have a lot of migrant populations that we need to reach out to. And so, you know, we're all similar in the fact that we don't have a wall that separates us. A virus doesn't stop at the borders. So we have to be very careful. And I would say that if we, first thing I got to tell you, I was a little surprised that the retail opened up. I thought they were going to wait until we had done our job, and then we would have a chance to open up. But then suddenly the retail opened up. That was a surprise to me. I would have rather have waited for all of us to be ready before we started opening the doors. But I understand the challenge.
Well, I know I'm looking forward to your questions because there's one about the restaurants and the 10 p.m. closing date, and I don't know where that comes from. So I'm looking forward to learning more.
Yeah, likewise. Well, let's actually move into some member questions now. Speaking of the tri-chairs, let's talk about TriMet. We're obviously connected by a single transit agency, and once we move into phase one, I think there's a lot of questions as the three counties obviously work together. What is being done to coordinate with the regional transit agency to help ensure safety of commuting employees? And I want to thank Chris Rich over at Perkins Coie, who's a great PBA member. So thank you for your membership and thank you for your question, Chris. And that's to all of you, the tri-chairs. What are we doing about TriMet?
I'll kick this one off. TriMet is and continues to be a really valuable partner in this effort. And I want to thank and commend all of the TriMet operators who, even when the Stay Home Save Lives order was firmly in place from day one, went to work to ensure that people were still able to move so that our essential frontline workers were able to get to work as well. So I thank them. I know a lot of them were scared. I will say that TriMet has done, I think, an admirable job of connecting and contacting public health to talk about what the best strategies are, because we know we needed to keep the buses running and transit running. So they've installed plexiglass shields, they've gone to no cash system, they've taken away spots on the bus so that fewer people can sit on them. I do think that this is an area that we have to watch carefully, though, because there are fewer seats available on the bus. There are fewer people who are able to travel at any given time. And if we have a bunch of people who need to get to work in downtown Portland, there are not as many buses running for them to get to work via transit. So that's something that's going to have to be watched very carefully. And we are in constant contact with them. The other thing we have to continue to talk about over and over again is personal protective equipment, PPE. A phrase I'd never heard until 8 weeks ago, but they need PPE, the people who are driving our buses and our transit system. So it's just one more, as all of these levers are in place together, it's just one more thing to think about.
Thank you for that. And now this is a great question from Scott Hibbs over at Standard Insurance. Scott, I hope you're doing well. And we're obviously big fans of the Standard here at PBA. So Scott's asking the question that it sounds like each of the counties are in a little bit different places in terms of meeting the conditions to open, which isn't really surprising. So the question is really, can we be assured that if one county is ready before the others, that it will move to reopen, even though it's ahead of the other counties? Or are you all going to just stay pat with one another in terms of reopening? So noting that there's differences in prepared prerequisites and all that. What will you do if you do reach the ready, set, go mark?
Well, I think we already answered that. You know, we're going to put in our application on the 22nd. Whether the governor approves it or not, that depends on her. It seems to me that it's not us that are determining what opens. It's the governor and the medical community that's telling us what opens. All we're saying on our end is we're prepared should there be a backlash. Like I said, I was surprised that the retail opened. And the next phase in 21 days, hopefully we get to it, will be something else. But I don't think it's really up to us whether we open or not. Our job is to protect the citizens when we open, that we can reliably provide the health care they need.
The virus is the one that's in control here. We have some control over our state of readiness, but our state of readiness is also impacted by the presence of this virus in our community. And that's why we're a little bit obsessed over the numbers. You know, what are the numbers of cases? What are the trends? How are we doing with hospitalizations? So we have to watch those numbers. Those numbers are really going to determine when we actually get to reopen. The governor can approve our plans and approve our applications, but if the numbers don't meet the criteria, then we have to wait.
Great points. And actually now I want to get into a piece that I think people really pulled out because it was mentioned a lot. And I think it's sort of the element that everyone is looking to. And I'm going to put together a few questions here. So I just want to thank several PBA members, Joy Jerome at WorkSource Gresham, Mike Larkin at NIA Elliott, and then Guillaume Ortega at Hand and Stone Massage and Facial Spas, who has presence in both Multnomah and Washington counties. So, two-part question here. How can people help source contact tracers and candidates for that position? Who do they talk to at the counties? How do they help out? And how do they help place medically qualified professionals with all of you? And then the second part related to that is that assuming that you don't need to have all the tracers hired immediately upon phase 1, because obviously the virus may not expand rapidly after a phase 1 reopening. Would you be able to reopen without having all the tracers hired up and ready to rock? So that's the two pieces of questions that I've got for you from some great members here.
Yeah, we have been allowed, and that was one of the things that we all recently learned in a call with the governor's office, that we don't have to have everybody hired, which is good, because if the surge never comes and we have all these people who are hired and we're paying them, it doesn't seem to make sense. So we don't have to have everyone hired, but we have to know that they're there and that we're prepared in case something happens. So that's one piece of it. The other, if people, we have a team of folks that are working right now and on our plan for hiring the necessary folks at the different levels of expertise, the different levels of experience, and the different levels of qualifications. So I don't have an address, a phone number to call, except I would say just to send me an email to my email address. It's mult.chair@multco.us. So if you send me an email, we will put you in the queue, and as things get worked out, we've already hired a lot of people. We need to hire more. So I appreciate people stepping up to volunteer. As we've all been saying, we're all in this together.
Absolutely. And I'm going to sort of take one more question, although we have a lot of questions. And what we'll do for those that we're not able to get to right now because of time limitations, we will make sure that these get over to all of you and your staffs, and that we get back to the folks that have asked them. And I'm sorry that we weren't able to get through all of them, but we are hitting up against our time limit, and I do not want to stand between folks and a locally sourced alcoholic beverage or a non-alcoholic beverage. So the sort of final question is kids sports, recreation in phase 2 or where are you seeing that? How is that going to be allowed for kids to be able to recreate in team sports or team activities with the summer coming right ahead of us, and then we have this virus facing us? Where are we with children's sports and recreation?
Well, as somebody who has 3 children, I will tell you, especially my middle one, who's a wrestler, is miserable being stuck in the house and not being able to participate in his activity. That being said, I haven't seen any specific reference to kids sports. I know that summer camps are being looked at right now by the governor's office. So I'm wondering if Leah is still on the phone, if she has an opinion on where kids sports comes into play.
Leah, if you're still with us.
Hi, I'm here. Yes, so we are still evaluating kids sports. I think what you'll see in the fitness guidelines that came out is that under phase 1, at least, we're still recommending no contact sports, which I know is really difficult. So that will be part of our phase 2 conversation, but we haven't quite landed where kids sports will land. And likewise, I've got 4 kids, and so there's a lot of pent up energy around. So hear you on that one.
Thank you for that. And that question came from our board chair, Vanessa Sturgeon, who's also an avid little leaguer with her kids. So thanks for that question. I just want to thank our panelists here, the tri-chairs, that's a new term, I'm really loving it, to Leah, to you in the governor's office and the entire team. We appreciate the fact that you were able to join us today. Thank you so much. And for everyone on this call, thanks for being with us. Thanks for being members. And I really encourage you on May 19th, we will be joined for our next series with Oregon's Speaker of the House, Tina Kotek, of course, a Portland rep who will be in the House. We hope you can join us for that. Take a look at the Portland Alliance website for more information. We hope everyone stays safe, stays healthy, has a great weekend. And thank you all to the chairs of the Tri-County region and for wearing that perfectly adorned mask. So have a great weekend, everybody. There we go. Chair Bernard's got it too. So thanks, everyone. Have a great weekend.